Okay, this exercise is called retraction extension. It's almost always a progression of the retraction exercise and usually only done if retraction is producing a favourable response for your neck pain, plus the addition of overpressure has allowed you to reach maximal retraction. Your symptoms are usually a lot better, but they're not fully resolved. So this exercise is appropriate for people with pain out into the neck, both sides, sometimes into the shoulder blade and frequently down the arm. If in doubt, usually best to see a qualified McKenzie practitioner for your original assessment to determine it's the right exercise for you. So usually this person is already responding to retraction exercises. So if I just sit myself with a lumbar roll so that as I'm performing the exercise I'm nice and upright. If you don't have one, you can use a roll towel. And so usually it would be a progression of retraction. So retraction exercises, especially if you've done 6 or 7 in a row and you're achieving kind of your end range pressure. Okay, so if we assume that I'm now reaching maximal retraction, and often I've done this exercise for days or weeks already, then I fully retract the neck first and then extend. Like the retraction exercise, you want to make sure you go to end range first before you start to extend, and you should only just go to the edge of pain with repetition. If it becomes easier, you want to gradually extend your head further and further backwards as you go. Now, care should be taken on the way back, not to protrude the head forward. So make sure you kind of tuck it back as you return to neutral. Now, once you're reaching the end range of retraction and extension, to gain the last little bit of extension, we use a maneuver called a wiggle, where we're just nudging further into the extension available range of movement. Now with that wiggle, it should be a small range, almost as though you're saying no, just to jiggle your head further and further back into extension. Now with this exercise, usually, as I said, retraction is performed first, and often 5 to 6 retraction extensions are added with the wiggle as tolerated after. Your symptoms need to be better after or more central, and movement should be better in all directions. Some people will not be able to tolerate this exercise in sitting or standing, even if they need this exercise, and they will have to do the lying version of this exercise, at least initially.